All right, today we're going to tackle a word that, let's be honest, sounds incredibly complicated: angiomyolipoma. It's one of those medical terms that feels a little intimidating at first. But I promise you, by the end of this, you'll see it's actually super simple once you know its secret.
So what exactly is this thing? Well, an angiomyolipoma, or AML for short, is a benign tumor, and that just means it's not cancerous, that you'll most often find in or right around the kidney. And you can see right here, it's made up of this really specific jumble of different tissues all mixed together.
And that really brings us to the big question, right? When a pathologist is looking at a slide just like this one, with all these different cells and structures mashed together, how in the world do they figure it all out? How do they find the pattern in all that chaos? Well, here's the really cool part. The answer has been hiding in plain sight the whole time. The diagnosis is, quite literally, written right there in the name. And this is where it all just clicks. If you break down the word angiomyolipoma, you get three parts. Angio, that's talking about blood vessels. Myo, that means muscle. And lipoma, well, that's just a term for a benign tumor made of fat. So these three pieces aren't just parts of a word. They're the three exact tissue types we need to hunt for on the slide. So let's put on our detective hats for a minute. Our mission now is to go find the evidence for each of these three tissues one by one, right there on the microscope slide. Okay, first up is lipoma. This one's the easiest to spot. It just means mature adipose tissue, which is really just the technical way of saying fat. Now, take a close look at the slide here. See all those big, white, kind of empty-looking circles? Bam! Those are your fat cells. That sort of ghostly look is the classic visual clue you're looking at the lipoma part of this thing. So that's one down, two to go. All right, our second piece of the puzzle is angio. This part points to the blood vessels. But here's the catch. We're not looking for just any old blood vessels. In an AML, they're really characteristically thick-walled and kind of abnormal. And check these out. You can see them so clearly here. Notice those really prominent, muscular, pink staining walls. They just look a bit disorganized, a little messy compared to normal, healthy vessels. And that very distinct look, that's our second key finding. And that brings us to our third and final piece, myo. This is all about the myotome, or smooth muscle, part of the tumor. These are cells that are typically long and thin, which is why we call them spindle cells. Now, this is absolutely crucial. It's not just about finding these pink, kind of cigar-shaped muscle cells. It's about where you find them. See how they look like they're growing or radiating right off the walls of those blood vessels we just identified? This really close relationship between the muscle and the vessels is a total hallmark feature. So, there you have it. Once a pathologist finds all three of these things together, the fat, those thick-walled vessels, and the smooth muscle cells coming right off of them, they've officially found what's known as the diagnostic triad. But, in modern pathology, seeing is believing, but we always want that extra layer of proof. While this triad is a super strong clue, there's one last test pathologists use to just lock in the diagnosis with absolute certainty. And they do this using a technique called immunohistochemistry, or IHC for short. The easiest way to think about it is like using special chemical stains that work like smart tags. They're designed to only light up when they find very specific proteins that are totally characteristic of these angiomyolipoma cells. So, what are these smart tags? Well, for an AML, the key markers we're looking for are HMB45, melon A, and smooth muscle actin, or SMA. When these stains are applied to the tissue and they light up the cells, it's the final, definitive proof that confirms everything we saw with our eyes. Case closed. Okay, so let's pull all these pieces together. We've taken the name apart, we've found all the visual clues. Now let's just run through our complete diagnostic cheat sheet one more time. And this slide right here is your perfect takeaway. It summarizes everything beautifully. First, you've got the location, most commonly the kidney. Then you have that all-important diagnostic triad, the mature fat cells, the thick-walled vessels, and those myoid spindle cells coming right off them. And finally, you have the positive IHC markers that just seal the deal. It's pretty amazing, right? How a ridiculously long, intimidating word can be broken down into simple, observable parts. It really makes you wonder, doesn't it? What other medical mysteries are out there, hiding right in the name, just waiting for us to look a little closer?